Hi, everyone. Welcome. Grab a seat and get comfortable. You have just entered the Smartest Doctor in the Room podcast, where you can get the best information anytime, anywhere. I'm your host, Dr. Dean Mitchell.
Today's podcast is a super exciting one for several reasons. First, this is going to be the 200th episode of the Smartest Doctor in the Room. When I first started this 5 years ago, I wasn't even sure I could get more than 10 episodes a year. So I've been pleasantly surprised, and the number of amazing guests I've had on the podcast, I hope you've enjoyed, and has been a special experience for me. I'm also really excited because my new book, Conquering Candida, will be released this week. It'll be available in a print and an ebook edition. And I hope if you have an interest in this, will purchase the book.
I'd like to take a moment to let my listeners know that my new book, Conquering Candida, is now available on Amazon in paperback and ebook. If you believe you suffer from Candida, this is the first book in 50 years since the original book, The Yeast Connection by Dr. William Crook, to give credence to this underdiagnosed and undertreated condition. If you also want to understand gut health and the microbiome, I also believe you will enjoy this book. I do appreciate if you read this book to rate it on Amazon and provide your comments and a review.
And the third thing today, different from my normal format, today I'm going to be the guest, and my friend, colleague, and outstanding functional medicine practitioner, Dr. Dana Cohen, the author of Fuel Up and Quench, she's going to be asking me the tough questions, so I have to get ready. So I am excited to welcome my friend, Dr. Dana Cohen, back on the podcast and let her interview me.
I'm so honored. Thank you. I feel like Joan Rivers to your Johnny Carson.
Oh, that's a good analogy.
We're dating ourselves. So I'm just going to jump in, and I think I'm going to go sort of, get the highlights of each chapter one by one. I wrote a list of questions, and I'm going to read the questions. I'm not used to hosting, so bear with me.
Okay.
We're going to start. First of all, let's start with the beginning. Why another book on Candida? Dr. Crook, William Crook's book, The Yeast Connection, is a classic in the field. I remember it was required reading when I first worked for Dr. Atkins in 1998.
Oh, wow.
I had to read that book. I remember recommending it to so many people. Now I'm not even sure it's in print anymore.
It's actually, it's so funny. I have it here. When I wanted to get it to, when I was doing my book, because it is a classic, and you got to read and reference a classic, but it was actually like a reprint, and Carol Dean, apparently who's a medical doctor and a naturopathic, updated it. I had a copy once of the original, which I thought was a little bit better, but yeah, this was a book, but he wrote this 50 years ago.
Yeah.
Which, I mean, again, he was ostracized. He was, gone after in so many ways. I mean, he was actually an allergist, and so we have that similar background, but he was crucified by the allergy and medical community. And, he only found a home a little bit among the slowly evolving holistic or functional medicine doctors.
I remember reading it too and thinking like we didn't learn this in medical school. Like, What is this about Candida? It was, I remember thinking at the time until I started treating it. And when you start to treat it, you start to realize, wow, there's something here. Like, this is really changing people's lives. So has anything changed in the 50 years since you wrote the book?
Yes, Dr. Cohen, a lot. And that's why I decided to write the book, because Dr. Crook, being a really good clinician, was diagnosing what he was observing. He was having all these patients come with these multitude of symptoms, which no particular specialist wanted to see, and they were falling into his lap. And he was treating him, which we can get into, with his Candida diet, which people abhor or are afraid of, or they thought was crazy back then, and now it's cool, as I tell patients, to be like gluten or dairy free. But he didn't know anything about the microbiome, because medicine didn't know about the microbiome. And that's what's really changed. So, and again, it's interesting, through the podcast and some of the guests that I've interviewed, like Mark Pimentel and Dr. Satish Rao, people I mentioned very early on in the book, have helped us understand the microbiome. And this is the big difference. So it really brings a lot of, I think, scientific validity to this
Yeah.
condition.
Yeah, I find that so true in so many things we do in functional medicine. As the years go by, the acceptance starts to come much later. Think about
Yeah.
vitamin D. How long have you been testing vitamin D and talking about vitamin D? Now it's commonplace. Before we were ostracized about doing something like that. Okay, so the first chapter in the book is titled Candida Confusion or Candida. What is the confusion about Candida and who is confused? Patients, us doctors, or both?
Yeah. Just to preface it, I kind of always enjoy when I read a book, if there's like a little bit of a quote before you read the chapter, and that it hopefully has a connection. And I heard this line from Dean Ornish, so I have to, I don't know where he got it from, because I don't think he came up with it, but the quote says, "You could always recognize the pioneers by the arrows sticking out of their backs." It's like in the cartoons, you see like the Indians shooting the arrows, and the pioneer was, running away, and that kind of what happens in medicine. If you're the beginning of something new, people, with that old saying too, they all disagree with you, they fight you until they accept you, that whole thing. But
Yeah.
I think the Candida confusion, and it's understandable among especially our conventional medical colleagues, was that Candida can only be a problem in like one of two areas. Either you are immune compromised, like HIV or a chemotherapy patient, or maybe a woman with vaginitis. And I know, and you and I both know something about this because when I stepped on the hospital ward right out of medical school in 1986, I immediately was taking care of 20 AIDS patients on the floor. It was just overwhelming. They were unfortunately all dying every week from some immune compromising infection, and Candida was one of them, or it made them extremely uncomfortable. They had what's called thrush, a white tongue that could even extend down their esophagus. They had other horrendous immune compromising issues such as pneumocystis carinii, pneumonia. So I think for a really long time, especially after AIDS, doctors felt Candida, these opportunistic issues could only be relevant if you were immune compromised, not thinking that the quote normal population could suffer from something like this. And for sure, that it couldn't give all these different symptoms. So I think the doctors were very confused. And in relationship to that, the patients were, because they wouldn't get validated. They might have picked up Dr. Crook's book and gone to a doctor and say, "I have all of these symptoms. I think I have Candida." And the doctor would roll his eyes and say, "That's nonsense." And then the patient walked out, with their head down saying,
Yeah.
I must be making this up.
Or the doctor, you'd be sick as a dog, and I just want to, we're clarifying there is a difference between systemic Candida versus what we're sort of talking about here. So it's funny because I do have patients still to this day that walk in and say, "I have systemic Candida. That's what I'm here for." And I'm like, "Well, you don't, and you need to be careful about who you say that to."
That's right. No, the language is important. And one of the things I emphasize in the book is, and this is also the big confusion that, and we're going to get into this, I hope, in the other chapters. It's essentially Candida overgrowth. It's not an invasive
Right.
infection. I mean, I would see, again, when I was working in my days in the hospital, a patient that unfortunately had like a leukemia or something and was on very heavy doses of chemotherapy medications. And unfortunately, with their being in a very immune compromised state, they could get some type of fungal like Candida or Aspergillus invasive infection, which was deadly. But the patients that we're seeing in our practices have essentially what I call Candida overgrowth, and we'll get into why somebody would have that. But
Yeah.
that's a totally different thing. And when you and I speak to other doctors, honestly, because we know they'll say, "Oh, Dr. Mitchell's treating Candida. He must be a quack or whatever too." And then once in a while, I'll reach out and talk to that doctor, and I really, honestly, after 10 minutes, they're like, "Oh, I didn't realize that. That's what you mean." So you're right.
Right.
Language is important.
My patients are always searching for credible alternatives to medications for their medical condition. If you've been following the podcast, you may have seen I have had on top expert in the emerging field of vagal nerve stimulation. One of my guests, Dr. Dave Raven, did groundbreaking work with veterans at the Pittsburgh VA, showing that using vagal nerve stimulation, he could decrease the post-traumatic stress symptoms of these patients. He later founded a company called Apollo, which has a wristband device called Apollo Neuro that delivers gentle stimulation to the body to help treat conditions ranging from anxiety, depression, and even poor sleep. It has a special app to your phone. It also has special programs for calm, unwind, and sleep. If you are looking for a drug-free way to get relief, you may want to try the Apollo Neuro device. Please see the link in our show notes or go to the Apollo website, but put in SMART-MD in the coupon space to get a 5% discount.
Yeah. Yeah. So we'll talk about, I guess, like CFO versus,
Yes, we will. We'll
and which
hopefully
is the
get
new
into it very
term that I'm
soon.
so happy. Yes. All right. So let's go on to the next chapter. In the second chapter, you discuss the microbiome's role in Candida. Can you explain what is the microbiome and what happens when Candida gets out of control? So
Yeah.
Candida overgrowth.
And I'll probably can't help myself here. I like a lot of times use the quotes. Louis Pasteur, the famous French chemist, immunologist, was quoted supposedly saying on his deathbed, no less, to another colleague, Nobel Prize winner, said to him, because Louis Pasteur was famous for discovering the rabies vaccines and, pasteurization. He goes, but it's the soil, not the seed. And what I want the listeners to know by that, meaning it's really your own immune system, your makeup, that really is the big difference in overcoming illness. Because, unfortunately, you can have two of the same people. They could be exposed to COVID, tuberculosis. Some will recover relatively well. Others will be devastated by it. And it really does have to do to some degree of their nutrition status. I mean, they knew this years ago too. The people within those tuberculosis wards, the ones who died and who got tuberculosis were usually malnourished, like during the Holocaust, horrible, horrible things. So, what I discuss in the book is about the microbiome. I mean, obviously, it's getting more and more attention these days from doctors and researchers. And we're understanding that, we are a composite of the bacteria, viruses, even parasites. Nobody likes to think about that. And fungi that live within us normally. And when this gets out of balance, that's where the problems begin. And, one of the people I interviewed on my podcast twice, once just a few months ago, is Dr. Mark Pimentel. He's at UCLA. He's really not only one of the top GI specialists, and he's the one who really kind of discovered SIBO, small intestinal bacterial overgrowth, which the test is done, thousands of times a week probably. But what Dr. Pimentel pointed out to me and in his work, because he's really on the cutting edge of this, is that a diverse microbiome is what makes somebody have a healthy microbiome and a healthy immune system. It's when the microbiome becomes homogeneous that the problems begin. And just to throw in a little medical term here, a lot of the reasons that our microbiome becomes homogeneous is iatrogenic. Unfortunately, the doctors have induced this with medications such as chronic antibiotics, chronic acid blocking medications, which are very powerful, the proton pump inhibitors, again, the women that use the birth control pill. So this was really, to me now, the science, which Dr. Crook didn't have at the time, that was explaining, wow, this is why a problem is happening, and Candida is a hardy organism. You start knocking out all the other ones, it's what's left. And when it's left alone and overgrows, problems
Yeah.
begin.
Yeah, so I think that's an important point that part of when you're thinking about Candida, thinking about how long have that person been on birth control pill? Were they ever on steroids, antibiotics? I always ask about antibiotics in childhood. I also ask about how were they born? Were they born vaginally or
Right.
C-section? Were they born, to a sterile environment without and not getting their mother's, vaginal microbiome? So. That is important to think about from a doctor's standpoint. Can somebody actually fix their microbiome?
Yeah, I believe they can. I mean, well, I like to get into that later on because it's kind of the protocol that I discussed in the book. It's definitely very doable. I've treated thousands of patients for this and seen, fortunately, really good results. So yes, I think the good news is you can restore your microbiome. It just takes a little work and I think support from a physician that's willing to work with you.
Yeah, yeah. I just want to go back to that term diversity that you said earlier. Diversity is such an interesting word in nature. I think nature always, in every way, looks towards diversity in our diets, diversity in our microbiome, diversity.
Mm.
So I think it's an interesting word to think about. Um,
Okay, actually, I
so
want to think, Dr. Cohen, I want to point out too, I think it's important because I actually also interviewed not a doctor, a journalist, believe it or not, Moises Velasquez Manez, I believe his name is. Very interesting guy. He writes for the New York Times Magazine occasionally. And he wrote a book called The Absence of
yeah,
an Epidemic or something. And
yes,
but one
great
of the
book.
things, yeah, he's terrific. And one of the things that he brought out, which I read a while back, and that what's really fascinating is that sometimes in some of these third world countries, or even there was in Eastern Europe before, let's say even Germany reunited, that in those poorer countries, sometimes a lot of these populations have a much healthier microbiome than we do, and probably because they were exposed to less medication. A lot of them live closer to, well, let's call it the land, be eating, fresher fruits and vegetables, not processed foods. So this was kind of fascinating because, again, autoimmunity seems like an epidemic here in Western countries in the United States, and yet it's much less frequent in, again, those like poorer countries. So
Also, I think, we've educated ourselves so much that we think we have to be so sterile, treat our
exactly.
kids so sterilely, and the, washing of the hands, and don't let them play in the dirt. And,
Right.
so it's, and
Yes.
there's real
Yes.
research on
That's
that
very
too,
true.
Yeah. So we need, let your kids eat dirt.
Yes.
Um,
Or playing dirt. I don't know about eating dirt.
I think there's something to it. I don't
Maybe
know.
that too.
Be
Okay.
careful. Um, So going back, Candida, as you mentioned, is always questioned as a real diagnosis. So how does a patient or a physician know that they really have Candida? Is there a specific test in the blood or urine or stool even that they can do?
Yeah. I think that's been the biggest Achilles heel of diagnosing Candida. I understand patients and physicians like a test, a really clear-cut test like we have with like celiac disease now, with blood checking antibodies in the blood that give you a diagnosis. And unfortunately, that doesn't still exist yet for Candida. And that's what makes it tricky because I do still feel it, like in Dr. Crook's day, it's a very clinical diagnosis. That's why I have in chapter 3 about the 15 Candida directed questions. I found them to be so useful um, because if a patient answers yes to even just a few of them, that already gets my antennas up because we'll get into this later on. I don't see every patient say, "Oh, you have Candida." I'm very discerning. I want to make sure. But if your history meets the criteria, and unfortunately, today, and that's I think starting to change. I see so many young patients in their 20s and 30s that have this, which is a little disheartening. And so many of them have a history of, "Oh, I was on tetracycline for 6 months for acne. Oh, I was on antibiotics for 6 months or a year for Lyme disease. Oh, I had a lot of sinus infections, and the ear, nose, and throat doctor always gave me cortisone and antibiotics." And then there tends to be always like this perfect storm. Either they have a lot of stress in their life, or something comes together, and they start to get really sick. And that's what typically ends up bringing them to my office.
Yeah, yeah.
Just to
Interesting.
mention too, because you brought it up, I have people all the time say, "What about my stool?" Well, the stool is not that useful. Again, Dr. Pimentel makes a great analogy. He says you really wouldn't check your garbage to know what you had for dinner. It's because the large intestine where the stool comes out is just not really a good representative of the microbiome or finding Candida. Um, Urine indirectly, but not great, and blood. I've been reading some papers more recently now about the immunoglobulin antibodies, but I'm still not comfortable enough to say that would help me make diagnosis. I really rely on the questionnaire that I use in the book.
Yeah, so I think just to clarify, it is a clinical diagnosis, meaning
Yes.
we don't have a specific blood test, and it's up to you and the doctor to sort of rule out everything else, anything that would be obvious, and then sort of get to, well, this is possibly Candida, and
Right.
and go through the questionnaire.
And, again, we'll get into this later on too. Typically, when I have a high suspicion, when I treat these patients, it only takes 2 or 3 weeks, and I know if they're responding.
Right. Yeah. 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 So diagnosis by treatment.
Yes. Hmm.
Um, I think the general public thinks of Candida and yeast infections as the same thing, in the sense that only women can get them when they have vaginitis. Is that true? And what are some other symptoms of patients with Candida overgrowth? And is vaginitis a symptom of a gut overgrowth of Candida?
Yeah. It's funny. My biggest supporter and my biggest critic is my mom still. God bless her. She's 80. I shouldn't say her age, but she's in her 80s. And when I told her I was writing this book, Conquering Candida, she said to me, "You can write a whole book about women's vaginal yeast infections." I said, "Mom, it's not really all about just that." So, I also really 25 years ago when I read Dr. Crook's book, because it's funny, I read it and put it down for a while. My wife, Ricky, was doing a lot of the work in that area because she was seeing a lot of the women in our practice. I did also think Candida only happened in women who had vaginal yeast infections. Although I did start to see, obviously, men with AIDS that had thrush in my practice. But, I always tell a funny story in my practice, too. My wife and I, for a while we worked in different offices and then we kind of merged. And I was doing early in my career a lot of classical allergy, and occasionally I'd be treating a patient for some type of condition, asthma or sinus, and they would say, "Oh, I see your wife does like nutritional medicine. Can I see her?" And I said, "Yeah, why not?" And sometimes they had like weird rashes or unusual symptoms that they probably didn't even tell me. And then, they would be seeing her and I hadn't seen them for a while. I'd see them in the waiting room and they'd be smiling and they go, "Oh, Dr. Mitchell, thank you so much for letting me see your wife." I'm like, "Okay, what did she do?" And then I'd find out. And then I'd say to my wife, Ricky, especially with a guy, she goes, "Dean, he's got Candida." I go, "What?" it didn't really register back then. But boy, when, the more I ended up getting into functional medicine and opening my eyes and recognizing these patients that I was missing, especially with the chronic sinus patients, that so many of them, it's due to Candida. And I always tell patients they get a little bit of a smile because I always love to go back to my medical school days. I remember when I was in pathology that when they used to do the slides where you look under the microscope to see the different tissue, that the vaginal tissue and the sinus tissue were almost identical. They used to try to fool you which one was which. And it turns out also the microbiome are very similar, believe it or not, in some ways. So this started really changing my mindset, how to look at this condition.
Yeah, the chronic sinusitis, being, yeast problems is very interesting. And I do think it's still way
It is.
underdiagnosed.
Yeah, our ENT colleagues don't really, I don't know. I know some, but a lot of them don't still get it. And unfortunately, they're fueling the fire because so many of the patients, they're uncomfortable. Either they get a surgery or they get another round of antibiotics or steroids. And I always tell my patients, unfortunately, what I see is that with the antibiotics and steroids, it's one step forward, they get a little relief temporarily, and it's 3 steps backwards.
If you've been following the podcast, you may know I practice holistic functional medicine and immunology. In fact, at Mitchell Medical Group, we've been treating chronic fatigue patients for 3 decades. It's critical in this work to have a trusted pharmacy that can compound medications for our sensitive patients' needs. ITC Pharmacy has been our go-to pharmacy the entire time. They can make medications ranging from thyroid hormones to dye-free medications for all of our highly sensitive, even allergic patients. If you or your holistic doctor are looking For these very specific patient medications, you can contact ITC at 888-349-5453. They have licenses throughout the country and can have medications delivered right to your doorsteps. My patients have been so pleased with their service, and you will be too.
Yeah. 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 It's a real problem. I don't know why they don't,
You gotta think
just a quick question.
immunologically.
Well, question about that though. Do you think that, not biopsying, but culturing sinuses, that they don't, would that pick up yeast
Well,
quicker?
that's an interesting thought. Sometimes it's hard to get to that tissue. One of the actually really important studies that got really, they thought caused a lot of controversy was actually from the Mayo Clinic. And I still hold to this paper because I think it's important. Got the name of the original author, but basically it was an ENT group, and what they did was they had done about 100 surgeries on patients, and so they had surgical specimens, and they sent them off for culture, and like 70% of these patients were growing out fungi,
Yeah.
and Candida
Yeah.
was definitely one of the main ones. So I thought that was like really important because yeah, you're not normally going to. We'll get into this later too with the gastroenterology stuff. You're not normally going to do such invasive procedures to make a diagnosis. I mean, hopefully down the line we'll have better testing, which I have suggestions for. I just have to find someone to come up and do it. I think you'll find it interesting, but yeah, I mean, I think there's like these little hints of proof, and we have to go on that.
Yeah. Yeah. All right, next chapter. We're going on to chapter 4. You discuss the diagnostic stages of Candida. Where did this come from, and how is it helpful in treating a patient?
Yeah. So again, my quote, I'm going to have to go back to Dr. Pasteur again. In the fields of observation, chance favors the prepared mind. I remember one of my medical school professors saying that line when we first started. And I was like, what does he mean by that? It takes a little while till something seeps in. And really it means, and I teach this to the medical students, is that if you're not looking for something, with open eyes, you're going to miss it. And I don't know I'm sure like yourself, like over the years, you think like, oh gosh, you're going to be this master clinician and see a rash and make a diagnosis. No, you have to look at hundreds of photos of rashes and do that kind of training to keep your eyes open to what you may see. It's not going to just hit you in the face. You got to be looking or thinking. That's the way I look at it. And that's kind of what happened though in taking care of all of these Candida patients that started coming to our practice. I started to see the and stage these different symptoms. I mentioned in the book essentially 4 stages that then it's not perfect, but it's uncanny how often patients have a combination, or I see them sequence through these stages, like where initially it's the gut, which again where the microbiome issue is. Then, and this is fascinating. Again, that's what I feels a really important scientific contribution is that then the patients have leaky gut. And Dr. Cohen, you and I know that as functional medicine doctors too, we also took a lot of flack for diagnosing leaky gut. Even though the patients all believe it, a lot of the other doctors are like, there's no such thing as a leaky gut. Guts don't leak. But,
Yeah.
Dr. Alessio Fasano at Harvard, he used to be at Maryland, one of the probably most famous celiac physicians in the world. He was the one who really showed the whole idea about leaky gut and intestinal inflammation in celiac patients. And this was really important because it helped explain why celiac patients don't just, again, when we were in medical school, there was about 2 paragraphs about celiac disease being in pediatric patients, if you remember. That's what I remember. And all of a sudden you get into practice and I'm diagnosing or seeing patients, adults, that have celiac disease. And a lot of them didn't even have GI symptoms or nothing dramatic. I had one patient that presented, I'll never forget, she was my first case. She was anemic and she was very weak, and I happened to be taking care of her because she had asthma. And I have to give this patient, the patients are so smart. I was taking care of her for a while, and she said to me, I went to another doctor and I'm anemic. Could that be connected to my asthma? And I thought about that, and I'm like, I don't think so. They're really different. And then, I don't know, she was a very smart young patient. She was in her early 30s, and she goes, do you think I could have celiac disease? And I'm like, celiac disease? That's what it's just with the GI. You don't have any GI symptoms. And then it's funny, she went to see another doctor who put her on iron. She got worse. She didn't get better. And then I said, I think you're right. And she ended up seeing Dr. Peter Green at Columbia, who's again world class. And he did an endoscopy, and sure enough, she had celiac disease. And once she was treated, avoided gluten, etc., her asthma cleared up, her energy came back. But I think like what Dr. Green and Fasano have really shown is that, again, this idea of the leaky gut, of the gut, which is only one cell thick compared to our skin, which is 7 layers thick. It's easy for what we call antigens and proteins to sneak out there that are not supposed to leave the gut. And we know, and I know from my infectious disease training, when a microorganism gets in the wrong place where it's not supposed to be, that's where trouble begins. Like people always worry about, E. coli in your gut. E. coli, there's plenty of E. coli in your gut. When it gets into your urine too much, then you got a urinary infection. So I think it's kind of understanding all that. So anyway, to go through the stages, what I saw was initial stage was the gut stage. The second stage I call with leaky gut. What I typically see is the women get vaginitis. The women get sinusitis. I've seen a lot of urticarial hive-like rashes that have cleared up by treating underlying candida when, again, the appropriate underlying factors. And then the deeper stages I've seen, what I call stage 3, is the brain fog. And I explained that it's very interesting when candida is really circulating and as an overgrowth, the yeast turns, when you have sugar and other things like that, it turns it into alcohol and acetaldehyde in the brain. So that's why you get like that brain fogginess. And the fourth condition, which was something that Ricky and I saw a lot in our practice too in the early days, because we did some work with Dr. Jacob Teitelbaum, a really well-known chronic fatigue specialist. Like a lot of these patients with severe chronic fatigue, a good proportion of them had candida overgrowth. And once we treated that, their fatigue improved. So that's, again, something I think in my book that's kind of special, from my own clinical experience and pulling together some of the science from really top researchers.
Yeah, I really love how far we've come since Dr. Crook's book. It's
Yeah.
empowering in many ways. In chapter 5, you have Dr. Mitchell's protocol to conquering Candida. So, what
Yeah.
does this involve? Why is it different from Dr. Crook's original plan?
Yeah. Very arrogant of me to put my name on a protocol, right? But I always said I wanted to be known for a treatment, not a disease.
There you
So
go.
maybe I got my wish.
I love it.
And again, I like the quote I used at the beginning of this chapter. This is from Eddie Cantor. He was a very famous comedian back in the day. He goes, "It took me 20 years to become an overnight success." And that's a little bit how I felt about treating Candida. When I first started doing this, I felt like I didn't know what I was doing. I would turn to my wife, Ricky, and get some guidance. And I was always seeking out other experts. And it was kind of hard to find. I get bits and pieces. But from doing this work for a really long time, you hopefully, if you learn from your patients, you get better and better at this. And so, another person I really have to credit who unfortunately has passed away several years ago was like Ann Borick. She wrote something called The Candida Cure. I got to know Anne. She actually spent some time in my office when she moved to New York for a while from California. And Anne she was like a naturopath. She wasn't a medical doctor, but she had a very strong reputation. And I think she knew Dr. Crook also. She apparently suffered from very severe candida herself and multiple sclerosis. And part of her book was treating herself to get better. But what I learned from Anne was interesting. She obviously was a proponent of the diet, which all of us are. We know having too much sugar in your diet is not good. She felt strongly that avoiding dairy and a lot of the wheat-based products was important as well. But another funny thing I learned from Anne, and of course I have patients follow the diet, especially in the beginning intensively, was that vitamin therapy was important because what I was finding when I first started doing this, that a certain percentage of my patients were getting the dreaded Herxheimer reaction or the die-off reaction, and I didn't really understand why. Because a lot of times I would go quickly into antifungals, which we'll get to, and I think it was just too much for their system. So I remember having a conversation with Anne when she was in California, and she said to me, Dean, if you treat these patients with vitamin therapy, like if you have access to IV vitamins or injections, you can really cut down these Herxheimer reactions. And she was right, because it's rare. It still will happen occasionally, but much less often than it did initially. So, yeah, I learned from Anne, and the other components really that one person I have to credit a lot to is Dr. Marjorie Crandell, who has her own great book, which I've had her on my podcast, called Overcoming Yeast Infections. I mean, she mainly does deal with the vaginitis, but she was a microbiologist, but she was a Candida sufferer herself for decades, and she really understood also the antifungals and how they were underused. And I
Yeah.
learned a lot from her. And the last thing, again, I drew on my experience on doing sublingual immunotherapy, because I've been a proponent of that for 25 years. I haven't given an allergy shot in 25 years. And, I wrote the book on that back in the day. But I end up using and applying for Candida. And I found that by doing that, two things we try to accomplish. One, to get people off the antifungals, because the antifungals work as long as you give them. And while some of them can be safe, you don't want to take that forever. And the immunotherapy helps boost their own immune system. And
Do you think part of that is that patients actually have an allergy to that some patients have an allergy
some
to
people
Candida?
say that. I just feel that I feel more you're building up these protective antibodies. It's keeping it in check. That's my
Okay.
best assessment at this point. And I also, the other point too is, as hard as the Candida diet is, I want to give patients the ability to expand their diet. And I think once they rebalance their microbiome, like we talked about earlier, that they can. I mean, I mentioned probably in the book, I'm a card carrying member. I mean, for many years, I had a lot of digestive problems. And once I did a lot of this work on myself, I feel much better. And do I cheat every once in a while? Yes, I do. And I enjoy it, but I don't overdo it. And again, try to, get that balance, you know.
Hi, everyone. I know you may already know from listening to my podcast that I specialize in treating patients with toxic mold exposure. It's become a serious problem for many years as we deal with the hurricanes and floods throughout the country. Even simple bathroom water leaks from a toilet in your home over time can contribute to mold buildup. I can help patients that suffer from the symptoms of toxic mold, but I also rely on the patients getting their current residence inspected so they are not continually being exposed. My go-to person for mold exposure is Joe Reese. Joe is a certified mold inspector with decades of experience. He is super thorough and gives you a straightforward assessment and tells you whether it's safe to live in your home or if there is mold. I should know. I used Joe when I moved to my new home 4 years ago. Fortunately, when I moved in, I smelled an unusual odor in my basement, and I immediately called Joe. He came over with his instruments, and he found the problem. Afterwards, I had remediation, and the problem was solved. Joe does inspections all throughout the country. He welcomes calls to his cell phone at 908-451-4592. You can also reach him by email at jprconsultants7929@gmail.com. Remember, mold in your home is not a good thing, but thankfully it's a problem that can be fixed.
Yeah. I always tell patients to, I think, this diet is not forever.
No.
But there's a life cycle of Candida. So the thing is, once you recognize that, oh, I think my Candida is out of control, then you get really strict again, and it may involve seeing you again and doing some
That is such a
antifungals and
great point. Thank
yeah,
you for mentioning that, because, like, well, okay, so people always ask the questions. They always ask, like, how do I kill this Candida? Will it ever come back? Those kind of things. And what I've seen in my practice is that patients get better, and not it doesn't take too long, which is nice.
yeah,
Then sometimes I don't see them for years, and then I get a call, Dr. Mitchell, it's back. Okay, it's like, what happened? And the two things I've seen is, oh, I had this procedure. I had to go on antibiotics, a dental procedure. I was on 2, 3 weeks, and there was another complication, another 2, 3 weeks. I said, oh, you should have reached me, because I would have put them on antifungals at the same time. That's actually what Dr. Crook did, way ahead of his time. He used to put people on nystatin when they were on antibiotics back in the day.
yeah.
And the other thing, the big mistake I see with patients, and we'll get to this maybe in the later diet chapter, is that people are doing so well, and then I said to them, "What's going on? Like, why? What do you think the real?" I don't know. I go, "I'm so healthy. I'm eating all these fermented foods like kimchi and sauerkraut and kombucha." I said, "That's not good for a Candida patient. Their gut just doesn't tolerate that."
Yes. It's the one place I think that it's not good.
It's not
Yeah,
good. So,
yeah,
and we fix them up again, but they get a little nervous.
yeah. So you and I are both functional, integrative medical doctors, and we believe in natural therapies when possible. You did mention nystatin, so I do want to talk about which antifungals. So first part of the question is, what antifungals would you use, and do you have a preference? And then what's your opinion of different herbs and supplements used to treat Candida, like pau d'arco or garlic, caprylic acid, coconut oil? And then just last part of that question is, do they need to be careful with herbs?
Yeah.
Some of those herbs.
Yeah, you do. I think so. Okay, so that's a really good question. And again, I learned a lot from Dr. Crandell and all this. I think also again a big difference was Dr. Crook didn't have access to anything besides nystatin, which was okay, but nystatin only works in the gut. It doesn't really get to the outside of the gut, candida. Although a lot of his patients still improved with the vaginitis, which was nice. But today, diflucan, which is, you know, widely used for Candida vaginitis, it's just underused. Doctors, unfortunately, too, and I guess I understand this, but they're really fearful of antifungals. So they'll give patients like 3 pills. And Dr. Crandell used to yell about this. She goes, "You are undertreating patients big time. They need at least 2 or 3 weeks because Candida gets in deep in the tissue and you're just getting the surface stuff." Um, and it's funny because I'm more afraid of antibiotics than I am of antifungals. you
Completely.
know?
Completely. Yeah.
So I've learned from her too a combination of things. Like if somebody is resistant to diflucan, which sometimes they can be if they've been given it frequently, I'll go to other things like itraconazole or combine it with terbinafine. There are ways of doing it. And there's some of the newer antifungals which are very effective. They're just very expensive. So I try to get by with that first line or two. But I have used the stronger ones. And it's interesting too because I interviewed Tom Chillen from the CDC, who's like in head of the uh, fungal branch there, and he deals with some of the most wicked fungal infections, respiratory and everything. And when we were talking about medications, and he uses doses 2 to 3 times higher than what I would typically use in my patients. And he says he rarely sees a problem because people are always worried about my liver going to be okay? And I'm like,
Yeah.
I've done this with thousands of patients, and I think I saw one case with a patient who had colitis. The liver was off a little bit. It's very rare.
Yeah. With
Um,
specifically with diflucan, you're
yeah. Oh,
speaking
yeah.
about
Yeah.
nystatin. It's not an issue.
Not even a
Um,
thought. Next time you can give to pregnant women, you don't have to even
yeah.
think really too much.
I just want to say on the same note, though, there are some herbs, though, that can, like caprylic
Yeah, no
acid,
herbs.
high
Yeah,
doses long term. And patients, these are over the counter, and patients think they have candida. I'm going to treat it, and they're taking large doses of caprylic acid on their own. That is something that is a little. It should be checked. I've never seen it in my almost 30 years of practicing, but it is something that exists, and patients need to be a little careful about.
I think people have to be so careful. First of all, I hate to say this, but I see a lot of patients that sometimes come to me from out of state who've been on the Candida diet and been on herbs, just really self-treating for
Yeah.
years, and they get
Yeah.
slightly better.
Yeah.
That's one disappointing aspect of it. Another disappointing aspect or scary aspect is like you said, I always tell my patients, I said the most dangerous medications you can take are the over-the-counter medications or herbs. Because if you're really not being monitored and you don't even know the interactions between one and the other, you're really working
Yeah.
blindly. And I don't like to work blindly. If
Yeah.
people really like these things, what I'll tell them is, once you're rebalanced, if you want to use it, in small amounts, that should work. Um, but otherwise, I don't, I'm not a naturopath. I'm not an expert on herbal medicine, but again, in all my years of seeing patients on it, I haven't seen anything miraculous. And where the medications and the diet and the vitamin treatments and my immunotherapy drops seem to really, I call, move the needle.
Yeah. Yeah. So in chapter 7, you bring up the connection between Candida and MCAS, which is mast cell activation syndrome. I send all my MCAS patients to you. um, Both have been controversial diagnoses, as we know. So, but how are they connected? And can you explain what is MCAS to the
Yeah.
listeners?
Yeah, I mean, it's really getting into that whole thing about keeping your eyes open. I trained, oh God, 40 years ago when I did my fellowship in New York City in allergy and immunology and infectious disease. I remember, I think, even doing a presentation on mast cells. And this is the funny thing, Dr. Cohen. When I had to do the presentation on it, when I went really all in depth about mast cells, mast cells were thought to be like only algae related cells. Like mast cells were only important if you had allergies. And I remember thinking over the years, just a little bit, my free time, like, why would God invent a cell just to torture allergy patients? I mean, it's got to, it's got to do something else, right? And then, unfortunately, sure enough, God spoke, and unfortunately, the COVID-19 pandemic hit, and so many of us were seeing patients with this quote long haul COVID, and I think it's going to really pan out, and it's being more and more understood that essentially long COVID, possibly chronic Lyme, a lot of other conditions, and I know this for toxic mold because I see a lot of toxic mold patients. What they're doing is they're activating mast cells. And mast cells are not just an allergy cell. They're actually, what I explain to patients, they're a primary immune cell. They're like what we call our patrol cells. They're patrolling around when you get a cut on your hand, when you get an infection. They're the first ones that get involved and respond. Later on, they bring in the T cells and the B cells and everything else, but they work immediately. And again, I make this analogy too. If they're always like on fire, if the stove is always turned up on high, you're going to feel awful because they're releasing all of these different type of mediators that make you itch, make you feel pain. So what I've seen, again, in treating COVID patients, treating toxic mold patients, and now I believe in Candida patients, that their symptoms overlap, and that can't be a coincidence. So I try to explain to patients, I can stabilize your mast cell activation, but I can really help you if I treat or identify the underlying problem, and treat that, and then your mast cells go back to being quiet.
To all my listeners of this podcast, you probably know I have a lot of experience in diagnosing and treating mold-related illness. What you might not know is that not all mold testing laboratories are the same. In the past decade of diagnosing mold-related illness, I have used exclusively real-time labs urine mycotoxin testing. It's a spot urine sample that accurately confirms my patient's symptoms as they relate to the mold exposure in their home. Now, there are other labs that do urine mycotoxin testing, but I have found from my own experience that they are not as accurate and reliable as the real-time tests. So, if you suspect you have a mold-related illness and go for testing with your doctor, ask them specifically that you want the real-time urine mycotoxin test. And you can say that you heard from Dr. Mitchell, it's the one that he trusts the most.
Yeah, that's a great explanation of it. I love it. Chapter 9 has what I believe is a very important place in this book. You go through the other diagnoses that should be excluded before assuming a patient has Candida. I spoke a little bit about this earlier. So what are the key takeaways of Chapter 9?
Yeah, unfortunately in medicine, it's very easy to, I forgot what they call it. There's a name for the type of bias it is. Was it relative bias or something? Like when you see something, so the next patient you see thinks he has that also, and then the next patient. In medicine, I did have a really good teacher at Columbia who used to say, especially when he was seeing a recurrent patient, he used to really have to take that moment and say, I got to look at this with fresh eyes. And also, there's also that analogy, like, just because you have a hammer doesn't mean everything's a nail.
I think of that with Lyme patients. I rarely send a patient that I think has Lyme to an integrative Lyme specialist because that's all they see, and they have bought themselves a year worth of antibiotics.
I agree with you.
Without even walking through the door.
I agree. I think it's more harmful than helpful, but it's, again, my personal opinion. But yeah, so
there's a place for it, but
right.
that's exactly why
in the
it is
right
that bias.
situations. But yes,
Right.
I agree with you. That's one of the things too I love about the work that we do, and why I don't just do. I mean, like, one of the things in my practice too, I do the sublingual food allergy desensitization, which I love because you have these kids, sometimes adults that are highly allergic, anaphylactic to peanuts and tree nuts, and I desensitize them to the point where if they have an accidental ingestion, they're protected. But I wouldn't want to just do that only in my practice. It's just, I guess it loses my interest, and I feel like that doesn't keep me as sharp in other things. So, and one of the things about Candida, which is interesting, if you really, do the thorough evaluation, it is interesting because you're trying to figure out what else could be in there. And I have a couple of interesting case histories in this chapter about people with other diagnoses that could mimic Candida. And so again, you and I both as physicians, you see, we have an advantage. It's really funny. Near my office in Long Island, there was a really good health food store. And I used to like to go there for lunch. And I used to like to talk to some of the people who worked there. They were very knowledgeable. And I'd see them. I used to sit there at the counter drinking my smoothie or juice or something, and they're busy like talking to these people at the counter like they're their doctor. I just sat quietly, and I kept on saying to myself, like, okay, I was listening to some of the knowledge that they were dispersing, and some of it was very reasonable, very good. But then on the other hand, I kept on thinking to myself, they don't know if that person has like an iron deficiency anemia. They don't know if this person has this. You and I, as physicians, can order blood testing or urine testing or do diagnostic radiology and make sure we're not missing some other treatable condition, because that would be god awful. Somebody, God forbid, has a cancer or colitis, and you're telling them, oh, you just have Candida.
Yeah, it makes me think about too. I'll say this to patients when they walk in the door, and the first thing they say to me is, I have Candida. I've seen every known doctor, and I stop them and I say, listen, I want to do you a favor. Just give me your symptoms. Let me,
Right. Don't
because
put a label on yourself.
you're already influencing me, and now that's all my mind is going to think
Yeah.
about. So any patients that are listening, start by just telling your symptoms, and then I'll always say to them, I want to hear your theories. I want to hear them at the end. But
Right.
right now, I want you to
Right.
just not influence what could be, because we
A
don't know,
hundred percent.
and you
A
don't
hundred
know.
percent. It's right. I mean, when people get labeled or they label themselves, which is even worse,
Yeah,
you're not doing it, and part of, I'm sure what you enjoy and I enjoy too, I love being a medical detective, so
yeah,
I want the clues, the hints. I don't want, if I knew the answer already, we knew the answer already, it wouldn't make it as interesting. And,
yeah.
but it's also just good medicine, uh, because, yeah, there could be a lot of misdiagnoses, and that's something we never want to happen.
Yeah. All right, so let's get into the Candida diet, the dreaded diet.
I thought we were going to skip this chapter.
Chapter 10. So the diet people love to hate. And
Yeah,
it is, I will say, it's a tough diet. I'll tell people right up front. This is one of the more restrictive diets I give to
yeah,
people. However, I always say it's going to change your life. And it
yeah.
really, really can. So, has the diet changed? And what's your approach to the diet to make it work?
Well, I will say this. It's the way you look at it a little bit, because, one of the things that have made life a little bit easier, people are going to healthier diets now overall. I mean, the educational level is definitely increased. I mean, back in the day, if you told people to eat this kind of diet, avoiding wheat and this and that, they were like, you're crazy, you're a weirdo, And now all the celebrities, the athletes, they're following some kind of variation of this diet. And it also keeps them slim, maybe don't need the GLP-1 drugs as much. But I do start out with saying the restrictions in the beginning, because I have to be upfront, and I think they're not unreasonable. I tell people, look, the processed sugar, get that out. It's not good for anybody. It's just, destroying your body. Cheeses, I'm a little bit flexible, though. Again, in the beginning, I'm a little bit strict also. For whatever reason, I don't think we really fully understand it. It does affect the microbiome. The grains also limited to some degree. I mean, only because people eat so much bread, and I also warn patients really clearly: the gluten-free products and breads and all that are probably the worst thing you can have. They're all processed corn, potato starch, rice starch. You're better off if you're really not celiac, which most people aren't. Then if you really feel like having it, have a piece of sourdough bread, but don't go to that stuff. I do have them restrict the alcohol in the beginning, especially when we're trying to rebalance the microbiome. So that
All,
part
all
hasn't.
alcohol?
What?
All
Well, just the
alcohol?
first 4 or 5 weeks, especially when I'm using
Okay.
the stronger antifungals. Later
Okay.
on, we're going to get to this. What I ask the patients to think about is this, and I think this is the understanding with Candida. We want a low glycemic diet. No, because
Bottom line.
sometimes too people get the wrong impression. They go, "Oh, I can't have sugar. It means I can't have fruit." Well, no, you can have apples and berries and a little bit of grapefruit. They're low glycemic fruits. I wouldn't have cantaloupe or watermelon, that kind of pineapple in the beginning, because you don't
Banana.
want your blood sugar to rise. Apparently, that could feed into the yeast. I mean, what
Yeah.
people didn't realize, but it was actually a very good book, Wheat Belly, I think by Dr. Davis, where he talks about, and people don't realize how much your blood sugar spikes from wheat products. And that's the whole thing. I mean, because Candida is an organism. It feeds on yeast. It doesn't feed on fat or protein. So by limiting that, that's really helpful. The other thing this is what I've kind of been a big advocate of, is fiber. I like to say fiber is your friend. And that's why, like even myself, every morning I have ground flaxseed in my breakfast, and with the nuts and seeds, because your microbiome, the good bacteria like that. Essentially, it's a good prebiotics. And so that's what I have people focus on. A lot of salads, have your protein with every meal so you feel full. One of the things that Joelle, my daughter-in-law, who's co-wrote that chapter with me, we really try to make it so that it's enjoyable. I don't want Dr. Cohen or any of my patients say, oh, I can't go out for dinner with my friends because I'm on the Candida diet. No, that's a lose-lose situation. You're making somebody antisocial and not enjoying life. But the good news is you can go to that restaurant, order a beautiful salad, have a nice piece of fish or meat. You don't, it's
Yeah, I
options,
agree.
you know?
I agree. I think it's preparing a little bit ahead of time and also just knowing this is not forever.
Right, and it's not forever because when you're feeling better, you can expand. Look, I know even myself, and I tell patients this because I'm very honest. I said, look, I cheat, but I don't do it too many days in a row. That's for sure because I don't start to feel great.
Yeah.
I pull back, and it's a tug of war. I mean, that's the way I can put it. But it is great in the beginning, though, if you do stick with it, and I'm able to do as you do with all your patients, do a program like this. I mean, the changes I see are miraculous. I mean, I had one guy, I can remember just now off the top of my head. He's been having itching for 3 years. And I actually didn't initially think it was Candida. We were like focusing on his environment and this and that, whatever. And then I really started to dig deeper. And then he had, according to the questions, some things that I realized would apply to him. And he was a little skeptical himself, and he loved socially drinking. He used to drink like 3, 4 times a week. He's just this guy likes, he has a nice life, he likes going out socially. And I said, look, you got to give me a little time here to work on you. But within 3 weeks, his itching disappeared completely.
Yeah.
So he and I were both amazed at the same time.
Yeah, that's the beauty.
You know.
Um, so how long patients always ask, how long am I going to have to stay
Yeah,
on this
that is
diet?
the first question. How long do I have to do this for? Well, look, I tell them, look, the first 4 to 6 weeks is definitely a good time to be as strict as possible. Then we start to expand. I like, what's it called? The Pareto rule, the 80-20 rule. Try to be good 80% of the time, and 20% of the time you can cheat. Just try not to invert that law and be good only 20% of the time and bad 80% because that can happen. And I also
Yeah.
tell patients this too, because I'm honest. I say to them, I actually like going to the supermarket. I like shopping and, for food, not for clothes.
Yeah.
And I tell patients this. I said, the real decision making goes on in the supermarket. If I'm going by the supermarket aisle and I'm pulling out the things, whether it's cheeses or this and that too, I say, oh, I'm just going to have a little bit. It's gone by the end of the week. But on the other hand, if I don't pick it and it's 10 o'clock at night and I'm searching my fridge for something and it's not there, I am not running out to the supermarket at 10. I'm too lazy to go buy it. So
Right.
shopping, and we have a shopping list in there, is important. So, but
Yeah.
I'm impressed. Some of my patients are really very good about all this. So,
Yeah. Yeah. Do you differentiate between, fresh and aged
oh
cheeses,
yeah, big time. Oh, thanks for bringing that up. I think when people say, "Oh gosh, I really love cheese," well, cottage cheese actually is a better choice. It's a little bit more water content. It actually also is more casein and not lactose. What people don't realize, like why also we tell them to avoid milk, is that milk is in a way a sugar. All those things biochemistry wise, oses. That lactose, fructose. All that oses are sugars, which again feed the candida.
Yeah. So, um, so last question. What, in your opinion, is the key to really conquering Candida?
I think it's the dedication to wanting to get better. I mean, we all know this in everything. If you don't want, if you're like, oh, if you're ignoring it, no, this can't be the reason, or you're not interested in following like a protocol like this, it's not going to work. That's for sure. The
Yeah.
second thing is, which is wonderful, if you have a friend, a family member, somebody that supports you through this, so you're not going at it alone and you're not isolated. I think the third thing, which is really, really important, is to find a healthcare provider that believes you and that's familiar with this. And the good news is there are more and more practitioners that are, because nothing like we talked about earlier on disappoints a patient more than their doctor not believing them. Gives them their own self doubts. And I'm hoping my book will be a nice guide that they could work with their local doctor with.
Yeah.
And I do
Yeah.
also encourage people. I've really one of the only big benefits I've seen of social media, because I don't do a lot with that. But if you find a community online where people share supporting one another, I think that could be a really good thing.
Oh, and they're definitely out there for
Yeah.
Candida. They're absolutely out there. Well, I hope the listeners have found this topic interesting, and if they or a loved one have chronic symptoms unresolved that sound like they may have Candida, please read this book and get educated. And well, Dr. Mitchell, I just want to finally say that you are finally the smartest doctor in the room.
No, it took 5 years. I'm only saying that it's all my guess. But I'll tell you, Dr. Cohen, you did such a good job that if I ever decide I need a break once in a while, you're going to be the first person I call to fill in. You're my
It's
Joan
my
Rivers
first
to
time
Johnny
hosting.
Carson.
I loved it.
All right, Dana, thank you so much.